If you're in your late 30s, 40s, or early 50s, and you feel like your body has started changing in ways that don't really make sense, don't worry, you're not crazy. Maybe your periods are a little different. Maybe your sleep is worse. Maybe your mood feels more unpredictable. Maybe you're gaining weight around the middle even though you haven't changed much. Maybe your libido is dropped, your joints ache, or you're suddenly feeling hot at night. And then you go to the doctor. They run a hormone panel and you're told, well, everything looks normal. And I understand that that can be so incredibly frustrating. And here's the thing, perimenopause is not always about hormones being low. A lot of time, it's about hormones becoming unpredictable. So the symptoms can feel random because the hormone changes are random. So today, we're going to talk about what perimenopause actually is, how it's different from menopause and post-menopause, and what symptoms are common, what symptoms are normal, and what should not be ignored. Hi, I'm Dr. K. I'm a pharmacist and clinician who works directly with patients on weight loss, hormones, and metabolic health. My goal is to explain these topics in a practical, evidence-informed way so that you can make more confident decisions about your own health. And just as a reminder, this video is for education only and is not personal medical advice. If you're having significant symptoms, abnormal bleeding, or concerns about hormones, please work with a qualified healthcare professional who can evaluate your specific situation. Now, let's break it down. So let's first define the terms because they get mixed up all the time. Perimenopause is the transition period leading up to menopause. This is where the ovaries are still working, but hormone patterns start becoming more unpredictable. Menopause, technically, is not a long phase. It's a specific point in time. Menopause is diagnosed after you've gone 12 consecutive months without a menstrual period, assuming there's not another reason your period stopped, such as surgery, certain medications, or an endometrial ablation. Post-menopause is everything after that 12-month mark. So when someone says, I'm in menopause, a lot of time what they really mean is either I'm in perimenopause or I'm postmenopausal. That distinction matters because a woman in perimenopause may still be having periods, may still ovulate occasionally, and may still be able to get pregnant, even though fertility may be lower. A woman who's postmenopausal is in a different hormonal state because ovulation is stopped and ovarian estrogen and progesterone production have declined considerably. So the simple version is this. Perimenopause is the transition, menopause is the 12-month mark without a period, and postmenopause is everything after that. For many women, perimenopause is actually the most chaotic part because hormones aren't just low, they're fluctuating. A common misconception is that estrogen simply drops lower and lower in a straight line. That's not really how it works. Let me show you. In perimenopause, estrogen can fluctuate dramatically. It can be low, normal, or even relatively high at different times. It's almost like it's on a dimmer switch that's glitching. That's why one month you may have breast tenderness, bloating, heavier bleeding, or mood swings. And another month you might have hot flashes, night sweats, vaginal dryness, or problems with your sleep. Progesterone is also a major part of the story because progesterone is produced primarily after ovulation. So if ovulation becomes inconsistent, progesterone can become inconsistent as well. That matters because progesterone is often thought of as a calming hormone, and it helps balance some of the effects of estrogen. So when progesterone changes sharply, some women may notice mood swings, anxiety, their mind spinning at night, or restless and interrupted sleep. So in early perimenopause, a woman may not be estrogen deficient all the time. She may have fluctuating estrogen with inconsistent progesterone. That's why symptoms can feel so random. Now the symptoms can vary a lot from person to person, but the most common ones include changes in periods, heavier or more irregular bleeding, hot flashes, night sweats, sleep problems, mood swings, anxiety or irritability, brain fog, headaches, joint aches, breast tenderness, lower libido, vaginal dryness, urinary changes, fatigue, and weight gain around the middle. Some women also notice acne, facial hair growth, or stronger carbohydrate cravings. And one thing I want to emphasize is that symptoms can show up before periods fully disappear. Many women are told, you're still having periods, so this can't be menopause. But that misses the point. Perimenopause is exactly the stage where symptoms can appear while periods are still happening. For some women, the first sign is not hot flashes. It might be sleep problems or mood changes or heavier periods. It might be anxiety that seems to come out of nowhere, or weight gain even though they've not really changed anything. That doesn't mean that every symptom is automatically caused by hormones. There's thyroid issues, anemia, other sleep problems, mood changes, medications, and other conditions that can overlap with perimenopause. But hormones should at least be part of the conversation. There are a few misconceptions I hear all the time. Misconception number 1, my labs are normal, so this can't be perimenopause. This is one of the biggest frustrations I see in patients. I often get patients who have seen 2 or 3 different doctors before they get to me and are relieved to finally hear that they don't have to just suffer through these problems. Hormone labs can be helpful in a lot of ways, but in perimenopause, they can also be misleading because estrogen, FSH, progesterone can all fluctuate so much during this time that a single blood draw is basically a snapshot of a moving target. A normal estradiol or FSH level doesn't automatically rule out perimenopause. That doesn't mean labs are useless. I do labs on all of my patients. It just means we have to interpret them in context. Symptoms, cycle changes, age, and medical history are so important in this case. Misconception number 2. This only matters after your period stops. And unfortunately, this is backwards. Post-menopause can come with its own issues, but the transition can have a lot of unpleasant symptoms. And when treatment is appropriate, timing can really matter. Research suggests hormone therapy tends to have the most favorable benefit to risk profile when started closer to menopause, especially in healthy symptomatic women under the age of 60 or who are within about 10 years of menopause. Misconception number 3, you just have to suffer through it. And that's where I say absolutely not. You don't need to white knuckle your way through years of poor sleep, heavy bleeding, mood changes, hot flashes, or sexual symptoms. There are options. Lifestyle foundations do matter. Sleep, protein, resistance exercises, fiber, stress, alcohol intake, and metabolic health all matter. But for some women, hormone therapy or other medical treatment may also be appropriate. That is a conversation to have with a clinician who understands how to properly address the symptoms of perimenopause and fully understands the difference between perimenopause, menopause, and postmenopause. Now, I often get asked, how long will this last? And the unfortunate honest answer is, it depends. Many women reach menopause between the ages of 45 and 55, with the average around the early 50s. The transition leading up to menopause can last several years. Early on, cycles may still be fairly regular, but you may notice subtle changes like shorter cycles, worse PMS, heavier periods, or sleep changes. Later cycles often become even more irregular. You may skip periods, go 60 days without one, then have one again. Eventually, once you've gone the full 12 months without a period, you are considered menopausal. After that, you're postmenopausal. But symptoms don't always follow a very neat timeline. Some start early, some appear later, and some, like vaginal dryness or urinary symptoms, may persist long into menopause and worsen without treatment because those tissues are very sensitive to low estrogen levels over time. Some change is expected during perimenopause, and it can be normal for periods to become somewhat irregular. It can be normal for flow to change. It can be normal to have occasional hot flashes, night sweats, sleep disruption, or mood changes. But common doesn't always mean ignore it. Bleeding is the big one. You should talk with a clinician if you have bleeding between periods, very heavy bleeding, periods that are much longer than usual, bleeding after sex, or any bleeding after menopause. The American College of Obstetricians and Gynecologists is very clear that any bleeding after menopause should be evaluated. And even during perimenopause, abnormal bleeding shouldn't be automatically brushed off as, oh, it's just hormones. Also, get evaluated if symptoms are severe, sudden, or not fitting the usual pattern. For example, If fatigue is extreme, I like to check for things like anemia, vitamin deficiencies, thyroid issues, sleep problems, medication effects, or other underlying causes. Now, my goal is not to scare you. I just don't want symptoms of other overlapping problems to get dismissed. So the big takeaway is this. Perimenopause is the transition before menopause, and it can start years before your period fully stops. It's not just low estrogen, it's often fluctuating estrogen, inconsistent ovulation, and lower or inconsistent progesterone. That can affect sleep, mood, metabolism, bleeding patterns, sexual health, and quality of life. And if your labs look normal, that doesn't automatically mean nothing's happening. Perimenopause is often diagnosed by the pattern, your age, your symptoms, and what is happening with your cycles. So if you feel like your body's changing and you're being told everything is fine, it may be worth asking a better question. Could I be in perimenopause, and what can we do to help me feel better while also making sure nothing concerning is being missed? Because you don't have to get through this by guessing. You need a clear starting point, the right evaluation, and a plan that actually fits what's happening in your body. And if you're wondering what can actually be done about perimenopause symptoms, stay tuned because that's exactly what I'll be covering in my next couple of videos. Thanks for breaking it down with me today. I'm Dr. K, and if you found this helpful, give the video a like, share it with a friend or family member, and subscribe to the channel for more health topics broken down. And let me know down in the comments what topic you want me to break down next.